Good evening, and thank you very much for coming at this joint reception by Louisiana Public Health Institute and BioDistrict. As the director of the Crescent City Beacon Community program, I think it gives me great pleasure to also see that we have a health information technology conference. It's the largest conference happening in New Orleans, which gives us an opportunity to highlight and showcase some of the great work that has been done in the field of healthcare and IT in New Orleans, and also celebrate the great future I think that the city has in bringing together health, technology, and innovation. Particularly our cooperative work with the Office of National Coordinator, with the State Health Department under the leadership of Bruce, and the local health department under the leadership of course, our health commissioner, Dr. DeSalvo, and our community partners, many of you I can see, who have worked really diligently to demonstrate how health systems can change using health information technology. But what is most important is actually bringing people together for a cause, and the cause is improving healthcare for the population in our region. And what we expect is that the work that has been done under the Crescent City Beacon program in partnership with a lot of partners and the community will be a good model for other communities as well, in terms of understanding how communities can come together to improve the healthcare system for improved population outcomes. With that, I would introduce Jim McNamara, who is our partner from BioDistrict. And the importance of this is really thinking of healthcare not only in terms of delivery of health services, but thinking of healthcare as something that goes beyond that, affects economy, affects the lives of people in our region. And so this collaboration is extremely important for our city, and we look forward to working further on this. Thank you.
Good evening, everyone. This is, I think, an historic moment for this city to see all of you all out here. I don't think it's ever been done before. So give yourselves a round of applause for being here tonight. Industry people, academics, we've got government officials, we've got policymakers, and the most important thing is we're mingling with each other, and we're introducing New Orleans to people that one day will hopefully invest in this community. So as Anjum said, we look at this collaboration as an opportunity to create jobs, to do economic development, to do something we call translational medicine, where one day we will hook our researchers at LSU, Tulane, Xavier, and even at Ochsner to other patients and other people around the world, so that we're engaging people globally through the connections that we have. And that's why this conference has been so important, is to connect us to the health IT industry. I have to point out a young lady, Helen Figge, who's going to be very embarrassed that I do this, but she called me through Ben Johnson with the Chamber, and was enlisted us to do some healthcare training, health IT training. And I'm going to give you some numbers. So we did some initial work through our resources. We had 200 people that we cut off the first wave. 157 were actually real addresses. 121 downloaded the material. 86 of those actually signed on and registered for the conference. 81 actually attended a full-day training. And as of today, reported back to me, and I've not solicited this number, 8 have job offers. 8. That is big. That's a big number. And I will say that, and I hope Norris, is he here? Norris, you're still here. So Norris, you didn't know this, but you committed to do another one of these. I didn't point out Norris, who's the COO, who is a really big friend of New Orleans and one of the big decision makers that brought this conference to us, and Carla Smith. I thought you had left, so I apologize. But it's been a fantastic display of the city. They've had a great time. We've had 1,200 vendors here for the past couple of days, and we've done a lot of selling on New Orleans, and a lot of people have become very interested in the activity that's going on here. So New Orleans will no longer be just identified as a community that has a good time. We will actually be taken serious when we talk about science and the biosciences and medical education and healthcare. So thank you very much. I'm supposed to call up Joanne. Oh, how can I miss Joanne? Joanne's actually the one who authorized the extra work. So come on up, Joanne.
Thank you so much, everyone, and what a pleasure it is to be here this evening on behalf of HIMSS. I do bring greetings, and we are very pleased to be certainly a partner in this effort, this transformational effort for health information technology, and this truly is a journey. I had an opportunity to meet with many folks here, Jim particularly, back in December, and I shared with him several personal stories. One of my stories, my daughter is a senior in high school. She will be graduating in June, and she has chosen the biology and microbiology as a career that she wants to pursue in college. And she is interested in working in health sciences and life sciences. And I said to Jim, there's really nothing in the Philadelphia area, which is where I live and reside and work. There's really nothing in the Philadelphia area like the BioDistrict. So I think it's fantastic, and who knows where she will end up, but certainly what's occurring here in the BioDistrict is definitely the seed for a national model for opportunity. And from a healthcare IT perspective, I have worked in a hospital setting, a small community hospital, Doylestown, Pennsylvania. I spent 18 years there. And I will be the first to tell you, there are approximately 64 departments in that hospital. Every department in that hospital uses some form of healthcare information technology, whether it's registering patients, whether it's the financial aspects, whether it's billing accounts receivable, admissions, registrations, etc. And that's what's so exciting about this program and this partnership, because we can bring to New Orleans the competency of healthcare information technology through our Certified Associate in Healthcare Information and Management Systems, and the accompanying exam that demonstrates one's proficiency in this area. So it's really exciting to me. I hold a certified professional in healthcare information management systems credential, which is much more advanced and much more rigorous, but this particular credential will serve the need for entry-level professionals, which is truly the need and the future of healthcare information technology. And on a final word, I practice again on a personal level. I'm involved in education that I take at a distance. So I am very, very supportive of virtual education, and I myself am enrolled in coursework, totally 100% online. And this is the type of programs that we're able to offer, not only those new to healthcare, but help folks sustain and maintain their credential. So on behalf of HIMSS, I thank you for this opportunity. Helen Figge, thank you for all the work that you and your staff have done, and we have much more to do. So again, thank you.
What drives part of the mission for HIMSS is membership. So as we get to know them better, we've got to encourage people to become members of HIMSS and become members of society. It's a good thing. And Helen, I want to thank Helen. I want to thank Joanne and all the members very much.
Without further ado, we'd like to invite Dr. Farzad Mostashari, the National Coordinator for Health Information Technology.
Thank you so much. It is a fantastic opportunity for us to be back here in New Orleans. I remember when the Beacon Community Program was just being stood up, and we invited all the Beacons to New Orleans, to the Crescent City, to kick off the Beacon Community Program. And I said, I may have rolled up my sleeves, I said, listen, this is the time when we get together, when we come together and we say, for the sake of the patients, for the very specific outcomes we want to accomplish, the community's got to come together. And it's not going to be, this hospital's interest or that hospital's interest. we have to become a beacon community because people will be watching. The country will be watching. There is a lot of attention on the beacon communities, and we will want to know, what were the outcomes? Were you able to make the technology that you have and the information exchange that you have meaningful? And the answer today is yes. The answer is that now we have over 200,000 patients who, if they have an emergency room visit, a notification will go to their primary care provider. When they get discharged, when there are referrals, those notifications are going, creating that seamless web, regardless of the financial system that that hospital or doctor is part of. We're seeing improvements in the quality of care for diabetes control, improving up to levels that are found not in what is normally thought of as the level of care provided in community health centers in tough neighborhoods. These are Kaiser Permanente levels of A1C control, and each one of those means saved limbs, saved eyes, saved lives. So I'm very proud to be back in New Orleans celebrating the success of the beacon communities of Crescent City, and to be here seeing on the ground what we expect to see across the country as we become a beacon nation, as the technology, as the information population health management tools, as the information exchange tools, as the patient engagement tools become more widely available, as payment increasingly rewards value, not volume, and as the hard, one by one, in the trenches work that the beacon community has done in clinic by clinic by clinic, changing workflows, redesigning processes. Someone's phone just whistled at me. When tools like these, connected, ubiquitous tools remind us that, I'm not going to tell. I just heard about a Cochrane review that said that reminders to cell phones can double smoking quit rates. That's pharmaceutical level effectiveness with a very favorable side effect profile. That's the future. That's the possibilities that we have now that we have a digital health infrastructure in this country. We now have to take steps we have the tools, we have the incentives. What is needed is will and leadership. And that's what's going to come out of every one of the beacons and all across the country, people who exert that leadership to take the tools, to take the steps, to say healthcare can change, must change. I think I'm going to get off the stage so that we can hear from two other leaders who have really helped set that path for New Orleans and for Louisiana. Thank you.
Thank you very much. We'd also like to welcome our Secretary of Health, Bruce Greenstein, to make some remarks. Thank you.
Good evening. All right, let's start out. Who here is not from Louisiana? Fair amount. Welcome. There's a lot of friends. I used to work in the technology industry before this job, and a lot of friends are here, naturally, to do business. And someone who I saw last night, I was talking to just about how great New Orleans is, and he said it's a great transition here. Just a couple weeks ago, we finished Mardi Gras. We had loud, obnoxious, drunk people all over the place, and now we have hymns. And the person said, well, it's just the same as Mardi Gras now, isn't it? And I thought, come on, this isn't such a bad crowd. I think about how great it is to have hymns here to shine a light on what it is that we're doing. And it's important to know that what we're doing here is not just about technology. Farzad just talked about having quit rates doubled when people get a cell phone reminder. Well, it was just maybe a year and a half ago that we launched our Text for Health initiative here. And we've been doing cell phone reminders within our Beacon program for quite some time now. And as I walked around the floor today at HIMSS, I was talking to a few other people and reminding them that what we're doing here should not be viewed as technology-centric. That for those that are in this business, if you're focused on technology as the end, you're in the wrong business. We're here to improve health outcomes and manage our costs. And if you get caught up and self-absorbed in thinking that technology is the end, is what matters, then we've completely lost the battle. We have to change behaviors for individuals. People need to be armed with technology so they can own their own health and make behavioral changes. Otherwise, we're not going to see an improvement on our nation's health status or the cost of healthcare for our nation. Here in this city, we've been doing an incredible amount of work and incredible innovations, using technology to give people the information they need, clinicians the information they need, and institutions the information they need to help on transitions of care, to manage chronic disease, and we're making a big impact. Talking about making this the Beacon Nation, we need a switch from the Bacon Nation to the Beacon Nation. We talk about, yeah, that was Dr. DeSalvo's line, actually. We talk about, and we've been talking about this for a while, to beaconize our state. And this is serious, because there are people here from hospitals all around the state. When we think about the Beacon Project, we think about, oh, that's great. We're making innovations for people that are uninsured or underinsured, people in low-income clinics around the city. But is it acceptable? Now, this is flipping things, so pay attention. Is it acceptable that we have better continuity of care, better transitions of care for people with no insurance or low insurance than the rest of the state has in many health systems? It should not. It should not. I have a good Blue Cross Blue Shield plan. I don't have the same access to the continuity of care that people do in the Beacon. So everyone associated with the Beacon should be absolutely proud of the progress that we made, and everybody from other parts of the state or other parts of the country should think about, how are those guys doing it there, and how can I do it in our health system? How can I use what they're learning and what they're doing to benefit our health system? That's the challenge for everyone else today, because the progress that's been made here is phenomenal, and we want to carry that progress on throughout the rest of New Orleans, throughout the rest of Louisiana, and hopefully the rest of the state. Enjoy your time here. Thank you very much.
Last but certainly not least, we have Dr. Karen DeSalvo, our local health commissioner. Thank you.
Well, good evening, everybody. It's really such a great pleasure to be here. It's been a nice week of celebrating the successes of our city in general, our ability to get back up off our knees after a pretty nasty blow in 2005, and begin creating a city that's as vibrant as the one that we're seeing today, and one that, gosh, come 2018, which is our 300th anniversary, is going to be almost unrecognizable, I think. And we are so well on our way to having that entrepreneurial spirit and culture that has permeated our healthcare resurgence, as you see in our health information technology successes, really bleeding into everything else that we do in this community. Many of you in the room are familiar faces, but there are some folks I don't know, and I just want to make sure for those of you who don't know that my history started on the street after Katrina, and building with many people here from the ground up a healthcare infrastructure that was poised and ready to meet the demand of implementing electronic health records, using the Regional Extension Center grants, working to exchange that data statewide through Health Information Exchange grant, and then locally working on not just the exchange, but thinking about how all those community providers and hospitals like Ochsner and West Jeff could come together and make a decision that they were going to not just use the data for the person right in front of them, but figure out how we could make people healthier in our entire community and focus on diabetes and cardiovascular disease and doing that. It has been a terrific journey to see the bricks and mortar go up, to see the data go into place, to see providers be able to use that information to the end of not just making that person in front of them better, but the entire population. One of the things I'm particularly excited about for Beacon going forward is not only the opportunity for our health information platform to be a job creator, to stimulate the economy and innovation in the healthcare space, but also to improve the public's health more broadly. And so the chance that we have in this community, well ahead of many others, is to think about how big data, like the big data that we have in our health information exchanges in the state, gives us a chance to know how to get ahead of public health challenges, whether it's diabetes or something like asthma. So it is with great pride that I've participated in this process of the Crescent City Beacon Community Grant as a steering committee member. I do want to recognize Sabrina Heltz, who's not here today, who is also on the steering committee with Bruce and I, and Joe Kimbrell. It's really been a great, easy job for us the last year or so since Anjum's been here to watch this thing explode and become a part of our everyday conversation here. So thank you all for being here to celebrate. Thank you all who have been working on this for so many years and doing such great advancement so that we can be a beacon for the nation. Thank you.
Thank you very much. We actually have one last speaker, Mr. Ben Johnson, the president of the local Chamber of Commerce.
Thank you. So I get to welcome everyone as well, and the New Orleans Chamber is really excited having you here on behalf of our Board of Directors and our Chairman's Council. The spin I would put on this is New Orleans is the only major urban center in the United States that's reinventing itself 7.5 years after Katrina. We're number one in public education reform, number one for startup small businesses, entrepreneurship, brain gain. Brain gain? Did I turn this off? So New Orleans has 100 different things that we're number one in, and we're really excited about this partnership with him. This is going to enable all levels of workforce the opportunity of becoming involved with the biggest economic development activity in the history of New Orleans. $2 billion worth of hospitals are coming out of the ground as we speak in our city. Thank you. $2 billion of hospitals are coming out. It's the money, I don't know. 2 major medical schools downtown, and to think of the partnership with HIMSS to help all of our folks become certified and become a part of this economic opportunity, we're just totally excited about it. So I just want to say thank you. The Chamber is committed to do whatever we can to make this partnership work. The BioDistrict is the future economic opportunity for our community. The last person I want to thank tonight is Michael Smith, who's the General Manager of the Hyatt Regency here in New Orleans. He could not be with us, and he is sponsoring this reception tonight along with all of our other sponsors. So thank you, and I know why everybody's over here, because the bar is that way. So thank you for being here.